It's Dr. Rick here at WNC Chiropractic, and we've been getting a lot of questions about health insurance lately and how it relates to chiropractic care. So we decided to create a video to answer some of your common questions that we receive. So I'm going to share my screen, and we're going to jump right into it. Slideshow. All right, perfect. So be ready to learn about the exciting world of insurance here. So here we go. So first, some common questions we get. My policy says I've got 30 visits. Why can't I use them? I didn't think I had a copay. I've got Medicare. Why do I need to pay for an exam? So if you look at this expression on the dog's face, we see this a lot when it comes to insurance. And like I said, we're going to answer some of your questions here and hopefully clear the air a little bit. So here we go. Some basics. Date of coverage. This is the dates your policy is actually in effect. It's usually a calendar year, so January 1st through December 31st is most common. Sometimes it'll run halfway through the year, through the halfway of the following year, and at the end of the policy, it will reset for the next year. So that one's pretty straightforward. Contracted rate. So what this is, it's a negotiated rate with the insurance company. So the example I've got here, if the cost of somebody's initial exam is $100, if they're not using their insurance, the contracted rate, if they are using insurance, might be $75. Now, the reason for this is that the office becomes an in-network provider, but they agree to the insurance company's rates. So it gives the member a little bit of a benefit for being with that insurance company as well. Contracted rates exist for any service provided that's covered by the insurance company, and different insurance companies have different contracted rates. It's not everybody doesn't have the same rates across the board. So here's an example. Like I said, if somebody's paying cash, you can see the price for the exam adjustment, a therapy, or even an extremity adjustment. Insurance one has one set of rates. Insurance two may have a different set of rates. So that's what the contracted rate is. We'll come back to this. Medical necessity. This is a big one. So this top line, you can see it's a term used by the insurance company to indicate the patient must have an issue that's working towards being resolved. Essentially, this means a person must be in pain to be able to use their insurance. So insurance only pays for care that is medically necessary. Our office, as the chiropractor, we have to create a treatment plan designed to help the patient get better as quickly as possible. So this means the visit frequency needs to be in place that's reasonably expected to help the patient improve. As you can see, for chiropractic at a minimum, this does mean that the patient should be getting checked about once every 2 weeks at a minimum in order to be medically necessary. So somebody cannot come in one time a month and file their insurance. The insurance company is going to look at that and say the visit is actually more wellness care, not medically necessary. So they're going to deny that care. So this is a big one. Medical necessity is a must if you're using your insurance. All right, let's move on. All right, so back to the first common question. My policy says I've got 30 visits. Why can't I use them? Well, because there has to be medical necessity. So that's first and foremost. So let's get into a couple other terms. You've all heard of these: copays, insurance, copays, coinsurance, and deductibles. So we'll start with the deductible, a set amount that the patient pays before their insurance plan kicks in. So if, for example, you've got a $500 deductible, you pay the first $500 out of pocket, then your insurance will start paying. So this is all based on the contracted rates of your insurance. So if you look, I give the example. If you had that insurance number one, where it's $75 for the initial exam, $45 for the adjustment, $20 for the therapy, that visit would cost you $140 if you have not met your deductible yet. On your next visit, if you receive an adjustment and 2 therapies, that would be $85. So between those 2 visits, you would have paid $225 towards your $500 deductible. And you're going to continue to pay this way until you reach your $500 deductible. Once you hit it, then your insurance will kick in and start to cover whatever your benefits are. Some insurances will pay 100% after you reach your deductible, meaning you don't have to pay anything else until the end date of your policy, as long as there's medical necessity. Some insurances will pay a percentage. So you may have, they pay 80% after you hit your deductible. You only pay 20%. So it's a nice benefit. And once you hit your deductible for the year, and your insurance kicks in, it will be that way for the rest of the year. And then your deductible will reset after your policy runs out and the next policy begins. So here's a little image to give you an idea. As you can see, you pay everything before the deductible. After your deductible, then you share the cost with your insurance, however your plan is set up. Okay. So copay, this one's very straightforward. It's a set amount you pay each time at the time of service. So we're considered specialists as chiropractors. That's the copay you would look for either on your card or if you look it up online. If you've got a $20 copay, then you pay $20 every time you come in. Your insurance pays the rest. Again, as long as there's medical necessity, okay? And this is based on contracted rates. So for that first visit, which is $140 altogether, if you pay $20 via your copay, your insurance would pay the remaining $120 of that. On your second visit, if you receive an adjustment to therapies, that visit's $85. You pay $20 copay, insurance pays the other $65. All right, here's your next common question. I didn't think I had a copay. Well, you may not. We don't know that until we submit your insurance and find out what's covered and what isn't covered. Sometimes the information on your card, we find out it's not correct. Sometimes we look it up online, we find out that's not correct. Sometimes we actually talk to an insurance rep on the phone and we get information that's not correct. So the only way we find out is once we submit it, it comes back, then we know. But with that said, we always recommend to you guys check your benefits before you come in, or if you get a new policy or a new card, check your benefits. You may have more luck than we will ahead of time. All right, and the last one here of the bunch, coinsurance. So this is one where you share the cost with your insurance company. So you can see the little picture there. If you have an 80-20 plan, they pay 80%, you pay 20%. And again, back to our example, the insurance number one that we used before, if the first visit is $140, well, your insurance pays 80%, that's 112. You would pay the 20%, which is 28. And your co-insurance plan could be a 90-10 plan. I just use the example of an 80-20, 70-30. It could be any percentage split. So it just depends on your policy. Another term here that you may have seen, an out-of-pocket max. So this is a set amount that represents the maximum that person will pay for the year out of their own pocket. Once you've covered that amount, the insurance covers 100% of the rest of your expenses as long as there's medical necessity. So this usually comes into play if somebody has an expensive surgery or some type of imaging procedure. Once you hit your max, insurance pays the rest. Here's the example. If you have a $1,000 individual out-of-pocket max, you pay the first $1,000, and once you pay that, insurance covers the rest, as well as any other healthcare needs that come up for the rest of that policy, as long as there's medical necessity. Now, I said this could be an individual. Sometimes we also see a family out-of-pocket max, where it's going to be a larger amount. But if, as a family, anybody under your policy, if you guys hit your out-of-pocket, then it's going to cover your benefits for the rest of that year or for the rest of that policy. All right, wellness care. This is where your health improves to the point that you no longer have symptoms, and then you switch over and you utilize chiropractic care to maintain and improve upon that. Which, side note, always is a good idea when we're talking chiropractic. It's not just about getting out of pain; it's about helping your body function at its best. But back to this, your insurance company does not pay for wellness care. They only pay for care that is medically necessary. So unless an insurance policy has specific wellness benefits, which you can find out, that's when people will switch over and we say, okay, we're done with insurance. If you're going to continue care, it's actually out of pocket at this point. And in our office, at least, we have very reasonable rates for that. So that's the wellness piece. Another term that you might hear is supportive care. And this is similar in that the insurance says we're not going to pay for supportive care. So the example I've got here, if patient begins care with severe low back pain, if their pain levels are a 9 out of 10 when they start care. They've had 3 segments fuse in their low back due to a previous surgery. So they begin care, they start to improve. We see their pain levels come all the way down to a 3 out of 10, much better than a 9 out of 10. However, because of their previous surgery, we see this is as much improvement as can be reached. So once no further progress is demonstrated and the patient's health has plateaued, It switches from medically necessary care to supportive care. So, like I said, the insurance company does not pay for supportive care. And so it's wellness care, you get to 0 out of 10, you feel good. Supportive care means we've reached maximum improvement. Either way, the insurance company says we're not going to pay for it. So that's where we would switch somebody over to a wellness plan. So, with that said, every so often there are exceptions to this. So it really just depends on the health insurance plan you have. Where we are, a state employee in North Carolina can be on the Blue Cross Blue Shield state health plan. This plan actually does have wellness benefits, and they've got a very reasonable copay. So you can continue once you've gotten better. You can keep on a wellness plan and get checked, every 2 weeks, every 3 weeks, once a month, whatever it is that works for that person. And all they have to do is pay their copay. So there are a couple of other insurances that do this. We always recommend check your benefits to be certain. Visit limit, it's a set amount of visits available per year on the policy. The example, the insurance plan offers 30 visits. We can still only bill your insurance if care is medically necessary. We had touched on this earlier in the presentation. And even if you got 30 visits, we can't bill wellness or supportive visits unless your policy specifically says that you've got it. And another thing to keep in mind here is that sometimes the policy will say you have 30 visits, and that is chiropractic, physical therapy, and occupational therapy. So between those three, you only get 30 visits a year. So always good for you to find out. Be sure what you've got before you get into it, so there's no surprises later on. So here we go. This is the one that's not like any of the others, Medicare. And as you can see, Medicare only pays for the adjustment, spinal adjustment part of the visit. They don't pay for your initial exam. They don't pay for re-exams, extremities, therapies. What's interesting is that in chiropractic, we're legally required to perform an exam on every new patient, but Medicare says they're not going to pay for it. So it doesn't make any sense, but that's the way it is. So that means the patient does have to pay out of pocket for their exam, any therapies, anything that's not a spinal adjustment. The patient has to pay for that out of pocket if they've got Medicare. So with that said, we're starting to see now very, very, very rare instances. There might be a supplemental Medicare policy that does pay for some of those things. And again, we don't know until we submit and find out. Our guess is as good as yours. Again, check your benefits and find out as best you can. All right. So that's the best advice we can give for Medicare. So yeah, like I said, I have Medicare. Why do I have to pay for the exam? Because Medicare only pays for the adjustment. That's your answer. So I've said it many times. Always check your benefits. After your first visit, we will bill your insurance. We'll submit everything to your insurance within either that same day or the following day. And sometimes it takes weeks before we find out what's covered or what isn't. So we always have to estimate what we think is going to be the out-of-pocket cost for you on that first visit if it's not clear. And as always, if we find that you've overpaid, we'll give you a credit towards your next visit or give you a refund. Like I said, there's no way for us to know exactly what's covered until we send it in. And check your benefits. All right. And please be patient with us. All right. We do see I understand it can be frustrating. You think you have one thing, it turns out it's not, and it can be frustrating. So we're doing the best we can. We want to make this as easy as a process for you as we can, and we want to make it easy for ourselves as well. And the insurance world is a tricky world, and it's not always the most enjoyable. It's lots of time on the phone and looking up benefits and receiving letters in the mail from them saying things need to be paid back and we need to send records, and it is a lot. So like I said, we want to make it as seamless as we can for you guys, and please be patient with us during this process. So that's all I got for you guys. I hope this cleared some of the confusion up. Again, take home point, check your benefits. If you get a new insurance policy or card, please let us know as soon as possible. A lot of times this will happen in January where somebody's got a new plan. And I hope you enjoyed the exciting world of insurance. All right. So if you guys have any questions, feel free to ask us. You can comment on here. We'll post this on social media. We'll put it on our website. And you can email us, call us, just let us know what your questions are. We're happy to help. But again, I hope this clears it up, and take care.